Hello, everyone. My name is Tom Nettel. I'm one of the executive directors here at the Homerton, and I'm the director of people. I also happen to be the executive on call for this week, the week commencing the 18th of January 2021. And we wanted to try something this weekend for a few weeks that we haven't tried before. And that is an update podcast from the executive on call and from the senior manager on call, which we can share with all of you across the organisation. And hopefully it will allow us to give you all a 5 to 10 minute update on what's going on across the organisation. And also for those of you that can't quite understandably always get to all your emails, gives you a different way of getting an update, and hopefully a really easy way of doing this, which is a bit of an audio podcast from us. We would really value your feedback. So when we promote this, you will see that mmcveigh has been helping set this up, and any feedback about this, anything that you think we can change or do differently or that you particularly like, please do let Michelle know and she'll feed that back to those of us that are going to provide the podcast. Okay, so we'll get stuck into updating you on where we are across the organisation. But firstly, let me just introduce the senior manager on call this week. Mags, did you just want to introduce yourself?
Hello everyone. Yes, my name is Mags Farley, and my day job here at the Homerton is the Divisional Operations Director for Surgery and Women's Health Services. And as Tom says, this week I happen to be the Senior Manager on call. So I just wanted to start by giving a little bit of an update of the position in the hospital today on Wednesday the 20th of January. As you'll appreciate, these figures kind of move up and down a little bit. But when we came into the hospital this morning, there were currently 157 patients with confirmed COVID-19 in our beds at the hospital, with a further 6 patients unconfirmed, but who are clinically suspected of having COVID-19. And as of this morning, there were 27 COVID-19 patients in our critical care department. Between the 11th and the 18th of January, so the previous week, we discharged 153 COVID-19 positive patients. So that gives you a little bit of a flavour of where we started today and what's happened in the last week. Obviously, there's been lots of pressures facing us as an organisation, and indeed our neighbours at this time. Probably fair to say the biggest pressures that remain at the moment is around critical care. In a normal kind of state of affairs, we might have an average of, say, 8 to 10 critical care patients in our beds. So to be running at pushing up 30 is clearly putting quite a lot of pressure on us, both from a staffing and a space point of view. So that is a particular area of pressure, particularly as all our surrounding trusts are in a similar position. So the possibility of mutual aid, whilst it is offered where possible, can sometimes be very limited.
Mags, just quickly, sorry, on mutual aid, just for people that may not understand it, when we say mutual aid, do we mean essentially where people have got spare or vacant ITU beds, and we perhaps had patients that we are struggling to accommodate, we would transfer those patients to another trust with capacity, and given the position, that presumably is much more difficult to do at the moment in North East London. Is that the best way of describing it?
Yeah, that's right. Yeah.
Okay, great. Sorry.
Yeah, so it is. It has been more difficult, albeit we have been working very collaboratively together during this period. But sometimes, obviously, people genuinely can't help, and we have helped many organisations and taken patients into our critical care. Also on the wards, there's been a lot of pressure too. We've got more beds open than we would normally have, and we're trying currently, obviously, to balance the sometimes conflicting pressures, if you like, of having a lot of COVID patients we need to look after, but also people coming to hospital, as I'm sure you all appreciate, for many other things other than COVID. So it's important that we try and balance that. I mean, of course, we need to keep those patients separate, hence why we have green wards, red wards, so that we're not obviously infecting people who come in haven't got COVID. So we need to keep those separate. And the only way we've been able to really manage this in a positive way is the help we received from so many of you who have been redeployed and have been working in areas that you're not familiar with, and I appreciate how stressful that can often be. But many of you have moved from your more traditional roles to work in the wards, in ITU, and many other areas of the hospital. And we do want to thank you for that, because without that, it would have just been impossible to get through these last few weeks. There are some areas that we still need some help, and I suppose the things that we struggle to cover a lot more are night shifts, particularly bed buddy shifts on ITU, and also the wards, and some weekend shifts. And again, I appreciate they're not hours that many of you might normally work, but if you do feel that you could offer that, then please do contact the COVID redeployment email, which is published in all comms, and we can put you in contact with the people who man those rotas. So I think that's where the main pressures are at the moment, but obviously things kind of change on a day-to-day basis, and if you obviously have any queries, then please do, contact your line manager. And I think Tom's going to talk a little bit about the support that we're hoping and plan to offer you. So do, hopefully.
Thanks, Max. Thanks. And I think just to reiterate your point, I think it is difficult to put into words how grateful we all are in the senior leadership of the organisation for the commitment and the willingness of colleagues to be redeployed during what has been certainly the most pressurised period the hospital and the NHS has faced. And it is important that people do understand the number of COVID confirmed patients we've had in the hospital on average, in addition to green patients, so non-COVID patients, is higher than we've experienced before and higher than the first wave. So onto some elements around how we're trying to support and perhaps protect each other. I want to just quickly talk about vaccinations. So the effort to vaccinate all our staff keeps on going, and as you'll remember, we launched that about 2 weeks ago on a Tuesday afternoon. I'm delighted to say we've vaccinated 2,700 people so far, and when it's worth just trying to keep in mind that we have around 4,000 permanent or fixed term staff, and probably another roughly 1,500 people who either work on our bank, work with us through agency, or are part of our really valued partners like ISS, Steris and ERS. So we've done a really good job of making progress there, but we still have lots of capacity to vaccinate people. And so what we really want to make sure everyone understands is that today on Wednesday and for the rest of the week, so Thursday the 21st, Friday the 22nd and Saturday the 23rd, we have got lots of capacity for people to be vaccinated and receive their first jab. Please, if you can, you will have received an invite and you can book in through that route, but you're also now able to come and do a walk-in and simply turn up at the vaccination hub, which is at the education centre in Homerton Hospital, and we can make sure that we record you onto the systems we need to do, our national system, and also the system that we as an organisation are using to manage and record this effort, and then we can make sure that you get vaccinated. So please do feel free to come and turn up if you haven't had the chance to book, and we will be able to do that. It runs from 8 till 6 every single day. So please, I can't emphasize this enough. Do come along and get your vaccine as soon as you can and when it's convenient for you within those hours. We also are, just as an aside, going to be doing some further webinars and some further FAQs and information, and we really want to hear from you. If there's a reason why you haven't been able to undertake your vaccine, then please feel free to email me, Tom Nettel, tnettel@nhs.net, and I'll make sure one of the team come back to you and talk to you about that. We really do want to understand what the barriers are to people getting their vaccination as well. The other thing to say, and clearly what Mags and I are doing today is part of this, is we want to continue to keep you updated. So tomorrow, Tracy Fletcher, our Chief Executive, is going to be chairing a webinar between 2 and 3 p.m. and we'll be promoting that today and tomorrow. And that's an opportunity for all staff to dial in. There'll be a number of us on that call, and we'll give a wider update. We may well share some of the updated position that Mags has described earlier for tomorrow, and also talk you through other key areas of focus, and you'll have a chance to ask us whatever questions you would like, and we'll be recording that and making that available too. And finally, we did just want to remind everyone, this is a challenging and pressurised time for each and every one of us, and we really do want to take the opportunity in speaking to you to remind you that it's really important to look after yourself and also to look after each other. Please do take a moment, if you can, as far as you reasonably can, to stop and think about your week and try and identify all of the things that you should be proud of the care you've provided, of the service and support that you've provided to clinical colleagues if you don't directly provide care. How are you feeling? Ask yourself how you're feeling. And if the answer isn't along the lines of good, please do remember that there is support available to you. We have our Talk Changes team. We also have our employee assistance programme, details of which are on the intranet and in emails that we've sent out before. And there is one-to-one support available for you. We're also working really hard to ensure that we give you support in the moment in your shifts. And so this week and from next week, we'll be rolling out the Feel Good Trolley to many of our most pressurised areas, with the plan to roll it out to all areas as soon as we reasonably can. And those Feel Good Trolleys will have refreshments, but also information about health and wellbeing support that we offer for you. And those trolleys will be, in some cases, peopled by members of the exec team. So you'll have the opportunity to be thanked by us, but also be signposted to areas of support and get a drink and take a quick break. Do remember that it is okay not to be okay, and what we really want to support you to do is to help you identify that and to create opportunities for you to be supported, to talk about it, and to get further support if that's what you feel you need and would benefit from. And finally, I guess, having said all of that, I think it's probably left for me and Mags, and I'll say thank you first and then pass over to Mags. But we really do just want to thank each and every one of you for everything that you're doing. Those of you that have been redeployed, equally, there are many of you in corporate support functions who have been working incredibly hard, longer hours, providing weekend cover to ensure that our colleagues providing care are as supported as they can be during this very pressurised time. And there's many of you who are in clinical roles who've done have worked significantly above and beyond, and we cannot emphasise how grateful we are. So thank you personally from me, and Mags, I know you will want to say thank you too. And if I just pass over to Mags to say thank you and then say goodbye. Mags.
Yeah, I'd just like to reiterate everything Tom said. Those of you in Swish hopefully will know what, if you like, our divisional motto, for want of a better term, is that we put in our newsletter each when it comes out, which is team together, everyone achieves more. And I think there's been incredible examples throughout the first and second wave of this pandemic during this last year of everybody really working together and demonstrating great teamwork, supporting each other in all sorts of ways, going above and beyond. And, I think that why this is just such a great organisation, because everybody does work together so well to support each other so that we can also provide the best possible care to our patients in these really extraordinary times. So we do not take it for granted, and we do just want to say a massive big thank you for everything everybody is doing, whatever your role. So yes, from me, an absolutely big thank you.
Thanks, Mags. So that brings our first ever podcast to an end. Please do give us feedback. Please do give Michelle feedback. We really want to know if you found this helpful, what can we do differently, what was particularly good. So yeah, hope you've enjoyed it, hope it's been helpful, and we look forward to issuing another podcast next week where you'll have a different exec on call and a different senior manager on call, and I'm sure they'll be working very hard to do an even better job than Mags did, and very easily exceed my contribution today. So please, all of you, do take care out there, and thank you again, and we'll speak to you soon. Thanks.